It's time to do some myth busting. The 3 biggest Obamacare myths debunked. Over the last week and a half, I've had the same conversation over a couple hundred times. This is the result of those conversations and the biggest myths that I kept hearing repeated over and over again. How's it going, everyone? I'm Joey Giangola with Giangola Insurance, and on today's health insurance break, we are going to get our hands dirty debunking 3 of Obamacare's most deeply rooted myths that exist right now. Number 1, there is no such thing as a government health insurance plan. Well, I mean, outside of Medicare and Medicaid, Obamacare does not create a new government health insurance option. No, it does not in the slightest. This is the absolute number 1 reason preventing people from wanting to consider options within Ohio's health insurance marketplace or under the Affordable Care Act. And it's not even true. I'm sorry for getting worked up there just a second ago, but I seriously lost count of how many times people told me I don't want the government controlling my health insurance. And that's great. That's fantastic if that's how you feel, but the thing is that they're not. No matter what you do, whether you buy an Obamacare plan or not, they will not be controlling your health insurance in any way, shape, or form. You're going to be buying health insurance plans from the exact same health insurance companies that you can today. Those health insurance companies are going to be the ones controlling your health insurance, not the federal government. Also, if your income does qualify you for a decent subsidy within the marketplace, you'd be foolish not to consider it. Just foolish. Number 2, you don't have to buy from healthcare.gov. I hate to admit it, but I have had a few clients tell me that they have attempted to purchase health insurance on their own from healthcare.gov. Going to healthcare.gov is the self-serve approach to handling your health insurance, and it is a completely unnecessary one. Any licensed agent or broker like myself is going to be able to help you bypass that mess that is currently sucking the life out of people. The best part is that agents and brokers can do so without adding any additional cost to your health insurance, and will be able to provide you with their experience and knowledge along the way. Again, as I've pointed out in previous videos, there are so many substantial changes happening to the health insurance policies from these companies that they're going to be rolling out at the first of the year that there's no way for you to know exactly how they're going to impact your health insurance. Well, unless you've watched and read just about everything that I've put out, then maybe you stand a chance. Otherwise, that information is not going to be readily available for you when you look to purchase your health insurance on your own. Also, some of that information isn't even available to me. Also, if you've gone through that process on healthcare.gov and included your current agent's information where it asks if anybody's helping you with your health insurance, I have serious doubts that that information is going to actually be credited to your current agent, as the website can barely take care of your information and function the way that it's supposed to. That's the absolute very first thing that they will just casually forget, which would then just ship your policy off to a random representative for that company that you purchased from. And number 3, your health insurance will cost less. Yeah, I know it's called the Affordable Care Act. Just recently, within the last 24 hours, I got my hands on some concrete rates as far as what things are going to look like. I actually took the time in this week's live hangout to walk you through them and compare them to what is available today. You can go ahead and check that video out right here if you want to go ahead and see that. But what you'll find in that video is that for somebody my age, a 29-year-old male living in Ohio, that rates are actually 3 times as much for almost an identical plan. Now, the term identical is relative in the sense that there are benefits that are mandated to be covered in the new plans that are not in the current plans, which is obviously going to impact the price. However, for most people, I mean majority, 95% of people, those mandated benefits will not be something that you will notice. So as you can see, they have actually increased substantially the cost of health insurance as opposed to lowering it. This has nothing to do with the politics of the law, rather everything to do with the insurance and the cost associated with it. Now, of course, those rates are unsubsidized, but if you are one of the lucky ones who will qualify for a tax credit or subsidy to potentially shave some of that increase off of your health insurance, it needs to be pretty substantial to help you get back to where you currently would be today. Well, what's the bottom line? Well, the federal government has done one thing very well in this entire process. And that's making you believe that there are new health insurance options available to you that you have to purchase on your own directly from them. Again, like I said, you're going to be buying plans that are very similar to what is currently out there outside of those new mandated benefits, and you're going to be paying potentially 3 times more for them. And you don't have to put yourself through the hassle of trying to use a website that was designed by a kindergartner. I'm just kidding. It's probably not that bad, but it is that bad. All right, well, I didn't say it, you said it. So now if you want, even more information about Ohio's marketplace and what it's actually going to do for you, I'd encourage you to go ahead and download our very free guide, How to Understand Ohio's Health Insurance Marketplace. It's going to walk you through all that information, let you know what you need to know about making that important decision. Go ahead and click on the cover of this ebook right here to do so, or if you're against that, you can go ahead and grab the link below in the video's description. If you're beyond that and you're ready to do something and you need some help now, you're ready to see exactly what these rates and plans are going to look like for you, well, go ahead, feel free, email me directly, joey@jingolainsurance.com. That email is right here for you. Again, joey@jingolainsurance.com. I will be happy to help answer any questions that you have and get you started with this process as best as we can right now. Of course, I do want to thank you for taking the time to watch this video. It means an absolute ton to me. And of course, as always, I am Joey Jingola with Jingola Insurance. Take it easy, everyone.